If you're planning on having hip replacement surgery, you're probably wondering what is the safest position to sleep in after the procedure. Because, yes, there is one specific position that you primarily want to sleep in after the surgery, not only just to reduce your pain and your symptoms overall, but to avoid any post op complications after the procedure. I'm Matt Sigua, a doctor of physical therapy, and I've treated hundreds of patients who had a total hip replacement. And if you're wanting to learn more about hip replacements in general related to physical therapy, please subscribe to the channel to learn more. So first, I'm going to explain the specific position that people are going to use after the surgery, but it's very important to understand why and what could happen if someone were to do any other sleeping position after surgery. So make sure you stay tuned for that and don't just skip past the video after you learn the exact position. All right, the supine position, or lying flat on your back, is going to be the sleeping position that generally is going to be used for a month after the surgery. So specifically, you want to be flat on your back with that surgical leg, or even both legs, but especially that surgical leg, elevated above the level of your heart. So typically, in terms of the positioning that you want to place yourself in, people will use thick blankets or some pillows and cushions, or even a specific type of bolster underneath the leg, underneath the knee, to keep that surgical side elevated. Now, in terms of how much to elevate, it's also going to depend on the type of precaution that you were given, but your physical therapist will specifically show you the height that they would prefer you elevate that surgical leg. But in general, having the surgical leg about a pillow's worth or a foot elevated, just so that it's right above the level of the heart, is plenty in terms of the height. Now, you also want to make sure that while you're lying flat on your back, sometimes we'll place a pillow between the knees just so that the surgical leg isn't crossing over the midline. We want to, in general, avoid crossing the leg after surgery. So in the nighttime when you're sleeping, having like a small pillow in between the legs, in between the knees, will help you avoid your body naturally trying to cross over. Now, obviously, we try our best to position blankets, pillows, and such just to reduce the possibility of that happening. Now, in general, sleeping is going to be uncomfortable that first 1 to 2 weeks after surgery, especially, but our goal is just to provide the proper positioning to reduce the possibility of breaking any post-op precautions, right? Now, in terms of how long you want to stay with these precautions, your surgeon and your PT are going to discuss with you according to your recovery, according to your symptoms and how you're healing specifically. But generally, that first 4 weeks, essentially a month, you want to be lying on your back for the most part. At some point when you're cleared to, you're going to be allowed to sleep on your side, but generally right after the surgery, sleeping on your back flat with that surgical leg elevated is the sleeping position that you want to start with. Additionally, with the sleeping position, we want to use pillows and blankets to position the leg, that surgical leg, in such a way that it's not going to rotate, so that you can picture the foot when you're lying down on your back. You want to make sure that it stays neutral, or essentially pointing straight up, and you position pillows and blankets so that it's supporting the sides of your leg, of your foot, so that the foot isn't going too far in or too far out. Sometimes you'll be discharged with some sort of bolster that kind of nicely places the foot and the leg in a neutral position that doesn't permit you to rotate the leg, so then that way your leg stays straight. So if you get discharged with one of those types of bolsters, that's even better. Some of those, we even come with like a strap to keep you on top of that bolster without the possibility of the leg coming off unless you unstrap it from it. But if you don't have one of those bolsters, then essentially you can just work with like some pillows and blankets to position that leg just so that it's blocked. Like, so you put the pillows and blankets on either side so that it's blocked from any type of rotation or going left to right. So that way you just avoid excessive rotation at the hip, which is definitely going to be one of the precautions after the surgery. So on left or right of the hip and leg, that'll just help you keep that neutral position for your hip rotation. Now, the problem with sleeping on your side, which a lot of people tend to be side sleepers, is the possibility of you breaking the post-op precautions. So, in general, depending on if you had an anterior or posterior approach, you want to avoid certain movements and positions of that surgical leg. So, for example, if you had an anterior approach, if you were lying on your side and that surgical leg happened to go behind your body, what is going to happen is you're going to be breaking that anterior approach post-op precaution. So essentially, you're not allowed to have your leg go behind your body. And if that happens while you're sleeping, because you're on your side, which is more vulnerable to, then you can cause increased swelling and increased pain and inflammation. And there's the possibility and potential of the joint dislocation if it's extreme movement, especially when you're sleeping, or if you're in that position for a prolonged period of time, you're going to have a lot of pain, and then you just have that potential to dislocate the hip. So one is we don't want to do the side sleeping because there's a possibility of breaking the post-op precaution. Additionally, because you're on your side, there's just a little bit more possibility of you moving, even if you position pillows or blankets to try to prevent that. The sleeping on your back is just a little bit more reliable in terms of you're more likely not going to move as much compared to if you were on your side. There's a little bit more possibility of excessive movement that we want to avoid after the surgery.